Hello, everyone. My name's Jamie. I have been working with NHS England and Improvement in conjunction with the National Clinical Audit of Psychosis, and we have been trying to find whether there are any inequalities in the treatment of psychosis or just any new insights into the treatment. Now, psychosis is a condition where people lose some contact in reality, and that would usually derive in symptoms such as hallucinations and delusions. And 3 out of 100 people actually experience psychosis at some point in their lives. And it affects all kinds of people from different ethnic backgrounds, different ages, and different genders. But the question I would pose to you is, let's say all of these people have the same severity of the mental condition. And if they were all to receive treatment, who would you say is the most likely to have a positive outcome, or better word for it, a reduction in their severity of their symptoms? And this is one of the questions that we sought out to answer in conjunction with NCAP, or National Clinical Audit of Psychosis. So NCAP is basically a project funded by NHS to improve the level of care of NHS trusts around England and Wales. And they basically do this by taking a yearly audit on all of these trusts and the services they provide, and then comparing them into a criteria to see whether they can be improved. But, like NCAP has this massive data set of 10,000 individuals going through treatment of psychosis, and they realize, well, there might be something, more feasible to do with the data besides this. So they come to us at faculty, and I was the one fortunate enough, luckily, to work on this really exciting opportunity. So I set out 3 objectives. 1, to assess the relationship between predicted variables and treatment outcomes for psychosis. 2, to build a model incorporating a wide range of variables which predicts a patient outcome. And finally, to determine which variables are most significant in predicting those positive and negative patient outcomes. So why does this matter, though? Well, we're taking steps, hopefully, to tackle health inequalities by identifying them to the psychiatrists. We're using machine learning to flag patients who are at risk of having a poor outcome so that a psychiatrist may adjust their level of care towards them, if necessary or appropriately. And finally, we're informing psychiatric care by determining the effectiveness of certain treatments and what works best for specific individuals. So that's all well and good, but how do we actually go about predicting these treatment outcomes? And this is where a thing called HONOR score comes in, which we are fortunate enough to have in the dataset. And you can think of this essentially as a score-based method of measuring the severeness of one's mental condition. And in our case, we focused on a thing called item 6, which measures the severeness of her symptoms such as hallucinations and delusions with the illness. So I took a subset of all the people in the dataset who had their HONOS recorded at 2 different time points. And from that, we can predict and compute a variable called HONOS change, which essentially just says, did the person have a reduction in their symptoms or not? Yes or no? So we now have that variable, and all we have left to do is to take all the nice individual characteristics and the treatments and interventions that these people went through, put it as input into a machine learning model, and see whether we can predict that change in HONOS. And as far as that went, it went pretty good. We ran with a support vector machine, random forest, and logistic regression, and we found that logistic regression was the best with an AUC score of 0.82. And as far as the variables that contributed towards that the most, probably most key to note here is that we found these predicted variables such as ethnicity and gender, as it turns out, as far as our results said, were not significantly statistically significant in predicting that relationship. But on the other hand, one that is more interesting is that 2 unsuccessful trials of antipsychotic was statistically significant in that relationship. And that actually may be because that is when a stronger antipsychotic called clozapine is administered, and thus would lead to more positive outcomes. So in conclusion, our initial results suggest that there is no evidence that predicted characteristics affect treatment of psychosis in England, which is good. It suggests that there's no inequalities. Second of all, we identified key variables that lead to positive or negative treatment outcomes. And third of all, we've shown that we can use machine learning to predict treatment outcomes. But this is the tip of the iceberg, to say, where there is so much more further analysis to be done. There's more HONOS items, such as ones associated with daily living. And there's different outcomes to consider as well, such as an outcome where a patient didn't have any change in their HONOS score. And it's also key to mention that these findings are not concrete. Further analysis would be done with more data, but luckily for us, NCAP will be starting a new program in 2023. And hopefully with the more data that these results bring, it will only strengthen the results we found even further. But with all that said, we are certainly one step closer to eliminating health inequalities. And thanks for listening.